Okay, so I'm going to be talking about medial and lateral epicondylitis and de Quervains tendonitis. So lateral and medial epicondylitis, also called tennis elbow or golfer's elbow. This is just the term associated with these common injuries. So lateral epicondylitis is an injury on the lateral side of the forearm. So tendons of the forearm that connect to the outside bump of the elbow. So the outside on this side. This results in breakdown or weakness in these tendons caused by overuse and strain of the tendons or the muscles in this forearm. It results in weakness of wrist motions, forearm strength, and pain. So you can see up here, this is kind of the targeted area where there's going to be pain. And it goes to the outside of the elbow, so the lateral side of the arm. So medial epicondylitis, also called golfer's elbow, these tendons of the forearm connect to the inside bump of the elbow, so the other side of the forearm. Excuse me. So this is a breakdown of these tendons caused by stress and forceful wrist and finger motions, which is why it's called golfer's elbow, because when you're playing golf, there's a lot of just extreme force to your elbow, and that can strain the muscles really easily. So this often results in pain of the inner forearm, stiffness, muscle weakness in the wrist, and then possible finger numbness in extreme cases. So same thing, this picture is just another demonstration of the medial side and the lateral side. Some different tests for lateral and medial epicondylitis. This is just to figure out whether it's lateral or whether it's medial. The Polk's test is set up. The patient is given a 5-pound book to hold with their elbow flexed. So I'm going to demonstrate it a little bit. So their elbow's going to be flexed. It's going to be against their trunk of the body. Just a little bit. It's going to be against their trunk. So they're going to have a 5-pound book. We're going to pretend that this is 5 pounds. And so if the patient holds the book while their wrist is pronated, and there's pain while lifting it up, there is going to be pain on the lateral side. So then it's lateral epicondylitis. If there's no pain, they're going to flip it over and they're going to hold their hand supinated. And by lifting it up, if there's pain, it's going to be on the inside and it's going to be medial epicondylitis. So then there's the Mills test. On the Mills test, the patient's arm is palpated by the doctor or the therapist with the elbow fully extended, pronated, and flexing the wrist like this. Like this. Flexing the wrist, flexing these muscles on both the outside and the inside. And just by palpating, they're going to be able to tell where the pain is happening. And once again, if there's pain on the outside, it's lateral. And if there's pain on the inside, it's going to be medial. Then there's the Cozen's test. The Cozen's test, the patient is put into a position with their forearm out in front with their wrist straight and radially deviated, so like this. And then they're going to close their fist with their thumb on the inside. And so the therapist is going to provide resistance to the wrist while the patient extends and lifts it this way. So if there's pain on the lateral side of the forearm, it's lateral epicondylitis. This is just a test for lateral epicondylitis. It's not a test for medial because these muscles are going to be on the lateral side. These muscles that are going to be stressed during this test are on the lateral side. So, some treatment options for lateral and medial epicondylitis. So because it's just a stress of the muscle and it's just a weakness of the muscle, treatment is going to look the same for both injuries. You're going to treat them both the same, just depending on the different location. So the treatment options that we have, there's short-term treatment, which looks like ice packs and muscle strengthening, and then stretching exercises to try to get full function, full flexion and extension back in those muscles, and then keeping those muscles strong so that next time you do that activity, that strenuous activity that's bugging those muscles, it's not going to cause so much strain. Ice also helps with inflammation. Ice is really important So going to long term, it's possible that you could be put in a brace, like an arm brace. Steroid injections like cortisone shots have been proven to be effective and to help calm these muscles down. And then there is a thing called lateral epicondyle release surgery. They just go in and make a surgical incision in your arm, and they basically just make more room for these muscles and kind of untangle any of the knots. They move nerves around, they move the muscles around so that it's not putting so much pressure on these muscles and that they can calm down on their own. But that long-term options are only looked at when the short-term options aren't helping and aren't proving beneficial. And obviously the lateral epicondyle release surgery is going to be a last term option or last case option. So medication, anti-inflammatory drugs are really important. Tylenol, ibuprofen, the basic over-the-counter anti-inflammatories to get those muscles to calm down, and then cortisone shots, again in extreme cases. For therapy, physical therapy and occupational therapy can be a benefit to patients or people with lateral medial epicondylitis. The main things that they're going to do, this is more leaning on the PT side, is going to be KT tape. Like as you can see over here, there's different formations to provide support to different muscles, just depending on which muscles are being strained the most. Gentle stretching and muscle strengthening just to keep up the functional mobility of your hand while your arm is still healing. And then this is a picture of electromagnetic treatment. It's a physical agent modality that can be used in this case. It has not been firmly researched to help for this, but in some cases it's been found to help. And of course, there's braces over here. So now, de Quervains tendonitis, also known as de Quervains tendinosynovitis. This is irritation or swelling of the tendons at the base of the thumb. So this is a completely different diagnosis. This causes swelling and pain with the thumb, and then can gradually grow to wrist movements. Pain usually starts pretty slow and dull while people are moving their thumb doing basic things, and then it grows to sharper pains over time, and soon they can't move their thumb at all without some really sharp pains, and then it also can spread down their forearm. This is most often caused by starting a new activity, so somebody learning to golf or play baseball, somebody all of a sudden putting their thumb in these abnormal positions or abnormal wrist maneuvering. It's also super common among newborn mothers because some of the nursing positions are just really abnormal in the way that they care for the baby and like picking the baby up. It requires a muscle that isn't normally targeted. Holding the baby requires thumb muscles that aren't normally targeted. So this is actually pretty common among newborn mothers. Catching can also occur in severe cases. Catching is where there's enough inflammation in the joint or in the tendon that it actually catches on something else, and your thumb isn't able to move because something is keeping it stuck. But that's pretty severe cases. This is just a picture demonstrating that, and this is the tendon that's going to be irritated, it's going to be stressed, and so if that gets stuck, that's not going to allow a lot of mobility for the thumb. Test for de Quervains tendonitis. So the Finkelstein maneuver can be done to test for de Quervains tendonitis. So the patient begins with their hand closed in a fist with their thumb on the inside. This is very similar to the test done for lateral epicondylitis, but it's testing something different. That one was looking at resistance and testing resistance of the patient with pain. This one is going to be a different a different area and a different level of pain. So on this one, the patient begins with their hand closed in a fist and thumb on the inside, and they're going to move their wrist outwards towards the little finger. So they're going to move their wrist this way. If the patient is able to do it at all, it's going to be really, really painful. And this section of your hand right here, maybe you can demonstrate it better here. This section of your hand right here is going to light up because this tendon is sitting right here and it is not going to like being stretched like that. And so this is going to be quite painful if the patient's able to do it at all. And it's a pretty, it is a very proven, a pretty telltale sign of de Quervains tendonitis. Treatment for de Quervains tendonitis, splinting can prove to be effective. A lot of people wait until they have some sort of catching in their thumb to get a splint for it, which you should get a splint as soon as you can. But along with the splint, there rest, ice, and just proper blood flow, making sure you're not cutting off the connection, that you're allowing as much blood flow to get to the thumb as possible to heal it and to release that tight tendon. Also stopping the activities that are stressing it as much as you can. Obviously, if you're a mother to a newborn, you can't exactly just stop taking care of them. And so that's where the splint comes in. It's going to keep that thumb stabilized. It's going to keep that tendon from getting stressed as much as possible. There is different types of splints, just different levels of stability, different fabrics, just about different everything. But if you do put on a splint, there is going to take extra time for those muscles to become strengthened once the injury goes away, once the tendon calms down. In extreme cases, surgery can be done to expand the area of the inflamed tendon. So they go in, they make an incision, and then they just make some room around this tendon so it takes the pressure off of the tendon, and then the inflammation goes down. If this surgery is done, it can cause a lot of other problems with other tendons and other injuries in the wrist, but you are not going to be able to move your thumb for a significant amount of time, so it's going to take a lot of time to get full functionality and full mobility back into your thumb and the wrist if you're wearing a splint for too long. These are my references. I got most of my information from this mayoclinic.org. And then these right here are videos of all of the different tests for medial and lateral epicondylitis. So lasting questions. What is the difference in diagnosis between lateral epicondylitis and medial epicondylitis? What's the difference? Which side of the arm? What does the actual diagnosis look like? What does the injury look like? And then 2, what would be a good OT intervention to do with a newly retired patient with de Quervains tendonitis that has taken up the hobby of gardening? So looking at occupational therapy specifically, how is this patient going to be able to engage in gardening with this new obstacle of not being able to move their thumb or not supposed to move their thumb?